Morning, Dr. Greene. Thanks for joining us. Before we get started on just to hear more from you, can you just tell us how long you've been at WPMG and in what roles?
Yeah, sure. I joined what was then Group Health in 1991. So in August, this will be my 30th year with the organization. And I'm an OBGYN, and I started with Group Health at Capitol Hill, and now I've been in Tacoma about 19, 20 years now. And I also serve as program chief or service line chief for Women's Health Services. And we have a maternal child program called Thriving Families. I get to be the medical director of that too, and that's been about 3 years for both those roles.
That's awesome. And on top of that, you have joined some of us in trying to do this community-based work around mentoring. And I
Yeah.
wanted to open with the first question, actually, about maybe some of the things that you recall getting to medicine. So usually during that training and education part, and that were probably unique to you, just being as a Black male, or that you think are going to be things that our mentees should really be aware of and know that could happen or could be part of an experience they need to sort of deal with.
Right, that's a good reflection. I would say, well, I was very fortunate to go to a program in the state of Missouri, Missouri, Kansas City, which was a 6-year combined BA MD program. So right out of high school, I was into this medical school basically, and we went pretty much year round. And it was interesting. There was 100 students in the class, and there were 10 of us that were African American. There were 3 males and 7 women. And by the time we graduated, there were 3 of us, 2
Mm,
men, 1 woman. And it felt like in that program that there were eyes on us all the time. We really felt collectively under the gun, especially as some of us started to drop out for either academic or social reasons. To felt like we had to kind of like carry this torch for our communities in a way, and the 3 of us came from very different backgrounds, as it turns out. But there were times during our training that we felt really. I try to find, can't think of the words I want to say, but I guess maybe that pressure, I guess, to say to really
mhm.
achieve, and at times felt like we were looked upon as maybe that we had to do more and more and more to make sure that we felt like we were in the right place, or maybe to justify our place, if that makes a lot of sense. So, not to say we had a chip on our shoulder, but we really felt this pressure, even beyond the regular parts of medical school that was already there.
Do you now, when you look back, have a sense of why there was attrition or what the university or the educational system could have done to create either a more equitable experience so all can succeed, or specifically anti-racist ways, maybe if that's what we're really talking about, to ensure that attrition isn't an issue for the Black
Right,
physicians there, or just others who are underrepresented in that program, actually.
right. I think there was a lot of overall attrition in those first 2 years. I think because it was a bit of an accelerated program, so you really had to stay, on tune. I think it was maybe overwhelming for some people,
Hmm.
just in terms of the rate of work. But I do have to say that I think that for the group of us, there had to be, or there's maybe a bit of a lack of support and maybe even role modeling, because all of our faculty at that level, none of them, there were no people of color in our program at all in terms of teachers and mentors at all, which maybe made it a little bit tough. This one friend of mine, actually, his father was a pediatrician, so we had some support collectively, but as a group, there wasn't maybe a whole lot of that. And so I think it's just a tough situation to be in. But I think, I came from a family that was very supportive. My father was a dentist, so I knew that I came from a bit of a privileged place in terms of what you were describing when we were talking earlier.
Hmm.
So I had a lot of support. I came from a, upper middle class family. So I had a lot of that around me. But one reason I wanted to be involved in the mentor program was I was always looking for that hands-on experience. And even though I had some support, I didn't have that inroads to get into a hospital or to be able to shadow or to have a physician that I could actually speak to one-to-one and offer that support. So I wanted to be able to provide that. Um, and I know as I'm in a role now that I can actually do that. So I'm very interested in this mentorship program that we're working on.
Do you, when we were talking earlier, actually, would love to hear about how through the medical school. Well, you talked actually a bit about the undergrad and then maybe into the medical school since it was combined, but also through residency and just beyond. If you were really a marginalized person in the sense that they were, or I would say underrepresented, or just not feeling like belonging, how did that manifest? What would you say? How did you describe that experience? But also, what were the repercussions of that? What were the consequences of being singled out or sometimes being in just a group without a community you felt like you could be fully yourself?
Right. I think we were talking earlier about hearing the term imposter syndrome. I heard it a couple times in the last, year and a half, and I hadn't really fully grasped what that was, but that was that feeling that I had that many times I was there. And should I really be there? Was I there because I was, a reasonably achieving Black person and needed some diversity on the staff? Was I chosen as a resident, because of that reason, as opposed to on my own real merits? And you always wondered, did I really deserve to be there? Or, you always felt like you had to, like I was mentioning earlier, have to even do more. I
Hmm.
think it does make you kind of question a lot of the time your role and maybe question your abilities. And one thing I was going to mention was in terms of like an experience I've had over and over was when I go to receive medical care, and this is not exactly the question you asked, is when I go to receive medical care, when people don't know that I'm a physician, and then when they realize that I am, like I've gone to urgent care a couple of times, this is maybe several years ago, and the person that came in to talk to me would treat me in a really kind of a way that just didn't feel very good. I can't really put my finger on what they were doing, but the way they were talking to me maybe or questioning my symptoms.
Hmm.
But then they come in later because somebody in urgent care knew who I was. They come in and say, "Oh, you're Dr. Greene," and then everything would totally change. Their
Hmm.
demeanor would be different, how I'd be spoken to would be different. And those would make me really sad because it seems like, this is the organization that I work in. And you would think that people would treat everybody with the same amount of respect, no matter what you did or who you work for. And so I know that when I was in medical school and in residency, I always had that idea that whomever I was speaking to and working with, that I treated them with the same respect as I would anybody else that I ever met. And that was the kind of thing maybe trying to get other people that you worked with, people that you were being taught by even, to try to get them to understand that that's a really important thing to offer your patients and the people that you work with. I'm not sure if I articulated that very well, but
No, you
um,
did. You actually did. And actually, I think it leads to the next question, which is, and I think you partially answered it, so I'd love you to expand on it, is, our mentors are coming from all different backgrounds, some with from the dominant cultures or overrepresented cultures,
mm,
however terminology you want to use, but just people who are interested in youth. And so I would want to know from you, what advice would you have about being a good mentor, particularly with the lens of racial equity, and kind of yeah, how would you give us advice particularly? And I would say for my disclaimer, my small group, we don't have any voices actually directly from our Black and Latino brothers and
mm,
sisters, or even our Indigenous folks and Pacific Islanders. And so, there's a lot of people we could think about, but we're not afforded that luxury, and so you are helping us actually just hear more perspectives. And so, what would you be your perspective on advice when it comes to mentoring?
right. I think based upon my own experiences and also teaching medical students over the years is really take a little time to get to know that student, where they come from, what's their background, what's their family life like, how did they grow up, because that has a lot to do with um, how they are perceiving their experience and what they're bringing to the program. Because someone like me, if you had asked a lot about me and know that I grew up in a pretty privileged point of privilege, as opposed to somebody that came from a poor background who's no one in their family's been in medicine. They may have been the first one to go to college, for instance. They have a different experience in what they're coming in with. So I think that's probably one of the more important things, is to get to know that person very well. And then and be a little bit vulnerable yourself. You know, tell them a little bit about your story, so that they get a sense that there's not this barrier between you and them. That even though that you are now a professional and you are coming from a place of power, so to speak, you want to break that down a little bit to make them feel maybe less, or maybe that's not the right term, maybe not less, maybe help them feel more included in the process so that it doesn't seem like it's a bigger thing than them,
Yeah.
if that makes any
And that they're
sense.
part of the community, that they're part of the
Right,
community, the relationship, as opposed to this unilateral, you just kind of give out what you perceive as your wisdom, but actually share in that human experience of going through medicine.
right.
That you did say that well. James, thank you so much for all that you do for the organization, but also for this. Really kind of great to get to know you, and we're happy to share this. This is actually really practical advice that you've actually offered. Happy to kind of discuss it more with the group. So thanks for your time.
Sure.
I'm going to